Hi, everybody. I'm very excited about our next guest. I had the privilege of having a conversation with this gentleman several years ago when I was curious about molecular hydrogen and knowing of its utility in my private practice. And of course, as you know, my area of expertise is oncology. And so I think this is going to be a really illuminating discussion today. Joining me is Ben Tameta, and he is just a whiz. The conversation I recall having with you, Ben, a couple years back still sticks with me. I was very much looking forward to having a revisit of this discussion and for you to share this information with the masses. So thank you and welcome here from Costa Rica.
Yeah, thanks for giving me the opportunity to share my story, and how we got here.
I love it. I love it. Well, first, I think people need to start with the most fundamental questions here. And I think the first one is what the heck is hydrogen water, hydrogen treatment in particular? Can you just start to build some fundamentals for us?
Right. Yeah. The basis of hydrogen therapy is what we call it, and that's kind of what we're focused on right now with this talk. Is hydrogen is a molecule, the smallest molecule in the universe, and it's naturally two hydrogens form to make the hydrogen molecule. They call it H2 for short, and it's used in health practices more and more nowadays. And we got into it a while back, say 5 years or so ago, and it's administered through a cannula. You breathe
Cool.
let me put it on quickly, show you how it works. Like most people think it's oxygen. So you just inhale the gas as it's produced live, on your desk in a machine. That, and we also infuse it through water, bubbling the hydrogen gas through water, which the water is, drank. So those are the two main methods to administer the hydrogen gas, which we call hydrogen therapy.
I love it. How did we learn about hydrogen? How did we know it was a thing to even use as a therapy?
Um, Yeah, well, that's a good question because it goes back to my story, which my background is an electrical engineer, so I look at it from an engineering and scientist point of view. I'm not a doctor, so you want to check with your doctor. This is right for you, kind of thing, right? Um, and so I got into it through studying anti-aging and natural health. Because I was looking to extend my health span more, and so as a byproduct of that, if you want to extend your health span, you're naturally avoiding and putting off any disease or degenerative, qualities or any being susceptible to those kind of things. And so that led me to a kind of a nerd obscure molecule that some people in the longevity community were using. But when I looked into working mechanism of that, I found this molecule kind of expensive and inert was actually acting as a transport mechanism for hydrogen. I'm like, well, let's cut to the chase and just focus on hydrogen. If that's the active, active ingredient or the beneficial molecule that's contributing to these benefits we're all seeing, in the anti-aging community, energy, recovery and healing from, all kind of, issues. And so I was already, doing experiments running cars on, hydrogen. So I was familiar with creating hydrogen on the fly, and you can't can or bottle it. So to be able to use it, you need to really, produce it, on spot.
Wow.
And so that got me into, okay, well, doing some research, I found that hydrogen is used, this is a while ago, but in some health studies. And so that got me to thinking, well, I could, as an engineer, I can make a machine and try that out on myself and to see
Mhm.
what works, what doesn't work. And so I made a machine, started using it, and I started getting these same benefits and then more. And then as I started sharing these benefits with friends, they're like, well, I want that too. I want that too. I said, can you make me a machine? And then so we kind of got, pushed into the business side of it, making these and sharing it with other people.
I love this. It's interesting. One of the reasons why you and I were brought together on a conversation is in the last several years, my colleagues and I have increasingly found more tenacious coagulation issues. We won't go into the reason for that, but people probably have a good idea of what I'm alluding to here. But no matter all my typical tools and tricks that worked on busting up fibrinogen, that came to helping impact platelet aggregation and all these things, they weren't working. So from just good hydration and fish oil and anti-inflammatories and proteolytic enzymes, even to pharmaceuticals like heparin and even the other like new generations of things like Plavix and whatnot, Xarelto, they weren't touching it. I couldn't get D-dimers to budge. I couldn't get platelets to come down. I couldn't get fibrinogen activity to come down. And just having a conversation with Mark Isaacson, a mutual friend of ours, he heard what I was struggling with, and he's like, I got a guy you should talk to that might have something that can help break this pattern. And that's where that was really, I mean, I'd heard of Brown's gas and hydrogen water, molecular hydrogen. I'd heard about all these things for many years, but I'd never had used them clinically. I didn't really understand when, where, why, how to use them clinically. And so I started experimenting. I actually had a few people get your devices and start to pre and post measure, and started to see some really extraordinary things where I was not making a dent with any of the old tricks. This was making a dent. And so before we go into more of the mechanism of action, could you maybe speak to what you believe, or at least what you told me in that conversation a couple of years ago, might be a mechanism of action of how this molecular or this hydrogen treatment could be impacting our coagulation pathways?
Right. Yeah, exactly. Because I mean, as an engineer in science, I want to know what's the working mechanism. Not just take this magic pill and you're all better. It's like I want to know why it's working, because if we know why it's working, then we can better target our delivery and administration of it to get better results in the end. And also too, that hydrogen is a natural substance in the body. There's a saying that fiber reduces the risk of cancer. Well, what is that working mechanism? What's the connection between fiber and a reduced risk of cancer? Well, the connection is there's bacteria in your gut that eat the fiber that produce hydrogen. So a nice healthy gut gut biome.
Both.
Yeah, exactly. It's all part of the same system, right?
Exactly.
Those bacteria eat the fiber, produces the hydrogen. So a healthy gut biome would actually produce as much as 6 liters of hydrogen gas per day.
Amazing.
So it's a natural occurring process in the body that we've evolved with over time, and so our body's adapted to need that and use it. And so not having that supplement in our body, inhibits some bodily processes. And there's 3 that I like to focus on that really stand out in how the hydrogen is affecting the body, and talking about the working mechanism. That's metabolism, how it directly affects the mitochondria and the production of ATP, circulation in your immune system.
Yeah, cool.
And to go into more detail into the metabolism, it directly works with the mitochondria to make that ATP, that current energy currency, which all the body cells need. It makes that process of ATP production more efficient. Because what we've noticed in both myself and clients is that once we start using hydrogen, whether we're inhaling it or breathing, or drinking the treated water, we notice an increase in energy. Cool. And so strength, endurance, recovery, and general energy, that's all increased. I mean, it's a direct correlation there. And because hydrogen is part of the mitochondrial process of creating ATP, it's taking that hydrogen atom, basically separating the proton and electron and recombining it. That separation, recombining, is a part of the process. So hydrogen is at the lowest level of that, energy production. And so without going into more detail on that, part of the byproduct of that cellular respiration, mitochondria, is the waste products, which are the reactive oxygen species, which are, superoxidase anions, like two negatively charged oxygen atoms here, the hydrogen peroxide, and also hydroxide or hydroxyl radical. Those are very reactive. And that's an end result of some of the cellular metabolism. And if those aren't neutralized really quickly, they tend to react with DNA and other important parts of the cell that can be damaged. And so the quicker those free radicals can be neutralized, the better your body can recover and or not be damaged by that garbage being created in your cells. And so if there's an abundance of hydrogen in your body, if your body is primed with hydrogen, then that's on standby, basically like a mechanic ready to fix your car if it breaks or clean up the mess. And so that quickly neutralizes those 3, reactive oxygen species to water. I mean, and water is pretty benign, so it's like you're taking hydrogen considered a selective antioxidant for that reason. It goes selectively after the most dangerous free radicals, as a part of that metabolic process. So that's really important for recovery. But to follow that chain, the working mechanism, well, where does that lead us? Well, if there's an abundance of these reactive oxygen species that are not being treated properly, then that leads to inflammation. And almost all age-related diseases, and many of the common names of diseases we hear today, they're associated with inflammation. And so these reactive oxygen species directly cause inflammation. So what we've seen, people that are become a regular user of hydrogen therapies, their inflammation goes away. And that can be shown in, like, you know, I mean, arthritis, joint pain, even
So
all kind of inflammatory.
symptomatically as well as laboratory results changing as well.
Right. Yeah, but the first one, people just feel and notice the difference in inflammation in their body. And so we notice and see the energy increasing, which is, metabolic. We see the inflammation going down, which it means that all these free radicals are being scavenged up and treated properly. And so those jumpstart the healing process of the body. And so that's all part of the metabolic process. And then the next thing, circulation, because independent of what the hydrogen is doing for the metabolism, what I've seen is the circulation you brought up a minute ago. It's like how different toxins, environmental toxins, whether they're put into your body or in your environment, you can look at, there's all kind of tests where you can see, blood cells clumping up. And there's a slide I use in one presentation. What's interesting is the blood cells naturally have a negative charge associated with them, like surrounding them, their natural negative charge. And if you think of two north poles on a magnet, they repel. You got to flip them north and south, they stick. So if your blood cells are damaged, they can't hold that negative charge. So you've got positive, negative cells, and you start stacking up like pancakes. And that leads to microclots. And so the hydrogen is negatively charged when you breathe it, when it's created during electrolysis. So while you're breathing it, it quickly dissipates into your lungs and brings that charge, that electrical charge, really quickly and directly to your blood cells. So it helps bring back that negative charge to your blood cells. And this is like almost something physical that's happened, aside from the chemistry and the biological processes happening in your body. And so when your blood cells have those negative charge, they bounce off each other. They don't clump up. And I actually bought a special microscope to look at the nail folds in your fingers, so you can see the capillaries. And so looking at someone starting to breathe the hydrogen, you can see some people are clotted up. They've got really dark spots of blood, and you can't see any circulation in their capillaries right here in their fingernails. So within 10 to 20 seconds, that's how quick it is. You can see the clots start to break up and the blood start to move and circulate. And it's just pretty amazing to see it firsthand. So we're not just like magic pill. I want to see what's going on. And it's great to see it having an effect that fast.
Amazing. I love this. I love this so much. And one thing that you also compelled, it was so compelling of what we talked about last time, and you brought it up a little bit for the recording, is that, especially the population we're talking to today, most of the people who are listening in on this are themselves someone dealing with cancer, or someone loving and supporting someone dealing with cancer, or someone treating somebody dealing with cancer. And so one of the cool things that we're always trying to find in our toolbox to support our patients are things that will not inadvertently impact the outcomes of any treatments. We don't want there to be any contraindications. We don't want there to be things that make things not work as well, or maybe make things work too well, so they become really hypertoxic. And one of the things that really struck me is how well this therapy plays well with others, including in the standard of care realm. So talk to us a little bit about that, where this has had utility in standard of care realm of protective and supportive and even maybe synergistic applications.
There's a few different directions to go with that. It's like, because it's non-toxic and natural, it doesn't interfere with other therapies. And when there is, other therapies, it's almost like it regulates many parts of the body. If things get out of sync in one way, it downregulates them. If things are missing in your cells or in different parts of your system, it upregulates them. It's very balancing. I know it balances the hormones as well. The only thing you have to watch with external therapies or drugs, because it does increase circulation and blood flow, some medicines may have a quicker effect or more enhanced effect. So the only side, I guess, not benefit, but thing you have to watch for is anyone on blood thinners.
That's huge.
People on blood, that's happened, to 2 or 3 of my clients that I know. When they start breathing the hydrogen, they're on blood thinners already because they've got very viscous blood. They start the hydrogen and the blood goes back to normal. And so they do one of two things. They either, stop the thinning medication, right? Or they get scared by their doctor into stopping the hydrogen. So what's more natural?
Right.
And another thing with the hydrogen, it protects from radiation, all forms of radiation, whether it's from the sun, UV radiation, chemical or alternative, cancer treatment or cancer treatments that have radiation. It forms a it's because it's there on standby, waiting to neutralize any radiation damage. Any free radicals that are produced as a result of any radiation are quickly neutralized. And again, going back to like real world results, I've got some clients that are either, bald or they meditate out in the sun, go out in the sun a lot. They come back to me. It's like, Ben, I notice I don't get sunburn anymore. I meditate out in the sun and I don't get red on my sun anymore. And I noticed the same thing. And so it's not like all these people are talking. They come back and they report this to me. So instead of putting sunscreen on myself, I'll do a quick hydrogen session for, a half hour, or just, 10, 15 minutes is enough. In most cases, then go out to the sun. I notice I don't get, sunburn or red anymore like that. It's amazing that how it protects the body. It knows what to do when.
I love it. So amazing. And one thing I'm always in awe by this, but I really want to highlight the fact that in all my years of being in medicine, I will tell you right now, folks, I mean, in the oncology space in general, there's been amazing research, amazing things out there, doctors very passionate about trying to change this. But the people who've made the biggest difference, in my opinion, in the last 10 years in the space of cancer care, both cancer care and treatment, but also prevention, are systems thinking engineers and biohackers. And Ben is both. And it's like, you have to be you've got to it's like that place where you can't see the forest for the trees. So you were someone who, through your systems thinking brain, through your solutions driven brain, you don't have all these other preconceived notions in your way, in your path. And so
exactly.
You can see things so much more clearly than the rest of us. And so, because I can almost hear people like, well, why didn't a doctor figure this out? Well, and first of all, if you go back and look in the literature, they have figured it out a long time ago, but they don't really know when, where, and how to apply it clinically. So how could you, as the engineer, encourage or advise a clinician to bring this tool into their practice, or to give their blessing of their patients bringing this into their homes?
Right. Well, I mean, after selling hundreds and hundreds of these units and getting feedback, we've developed our own protocols, over the last few years. And so we have a really good idea on how much is enough and how much is too much, there's not really too much, but I do find that too much of a good thing is not always a better thing, right? And so there's times where you actually, after exercise, you want oxidants in your system because your body, that stimulates your body to grow and recover. If your body is always neutralizing everything, that's not a good thing necessarily. So you want to, do certain times, or certain times are better to do the hydrogen than others. If you've got a specific condition you need to treat, then sometimes it's better. More is better in those cases when you're trying to jumpstart your systems. So we've got a lot of feedback from our clients. Just no technical or clinical trials, but I mean, just real world experiences. As an engineer, that's what I'm mostly interested in. I never got into this to make money or start a business. We got pushed into it, and just my curiosity in just engineering brain and why is this working and what is working, and asking people, what's working for them. So we've built up our own protocols and even external treatments where, I've cured a torn rotator cuff in my shoulder. It wouldn't heal for anything. At 8 months of pain, I couldn't even lift my shoulder, but bagging that limb. If you have problem joints or problem parts of your body where breathing the gas may not necessarily get to really easily, we resort to bagging, different parts of the body, even your wrists, your elbows, your knees, your feet, your joints, if you sprain ankles, because the hydrogen directly infuses. It's such a small molecule. It infuses into your skin, into your systems, that increases the circulation, better nutrient delivery, better healing, and faster healing. And so we've got experience with different protocols and when to use them.
Well, it's interesting because, hearing you, there seems to be a lot of similarities to the clinical applications of hydrogen to what many of us are already familiar with oxygen therapies. Now, oxygen is going to release a few more reactive oxygen species, right? So I'm always having to have patients and doctors pull back the reins when they kind of push too hard with too many oxidative therapies, with too much oxygen therapy. It almost sounds like hydrogen was almost like the yin to that yang, maybe more pushing it and balancing. First of all, how do the two? How would you compare and contrast them? And when might you apply them, and in what order and what situation, if you've got some examples?
Yeah. I like to use them together because being through the process of electrolysis, using the gases, we're breaking up a water molecule into hydrogen and oxygen. And so your body produces water as a part of the cellular respiration. It's part of the byproduct. And so we're breathing, oxygen, your body's making hydrogen naturally. And so your body is almost, taking it apart and making water, naturally. So you said the yin and the yang, they kind of go as a pair.
Yeah.
And so the machines that we use and sell on our website, they're both hydrogen and oxygen delivery systems.
Oh, cool.
And so oxygen, too much oxygen by itself could actually be harmful. And it could actually make you dizzy, and your body, it changes the pH of your blood and reduces your body's ability to absorb oxygen, right? And so having that hydrogen there, it helps balance all that out. So that I think they're made to be administered together.
Love it. Okay. That's beautiful. That's perfect. That's perfect. And so one of the things you struck me about is a utility of this that might blow people's minds, where you're thinking, well, this is so fringe, or this is so not utilized in any clinical environment. Tell us about what you told me about NASA and where they're using it there.
Right. I mean, I've read hundreds, if not thousands, of research papers, anything I can find, not just on hydrogen, but obscure things that maybe try to connect the dots, to find more working mechanisms that was working. But I did find a paper that explained how, when NASA did a study on how can they best protect their astronauts from solar radiation on the way from, say, the Earth to Mars, because it's a really long trip. They said, when you can probably find this research paper online, they said the best way to protect yourself from radiation is to breathe hydrogen, because it has benefits.
Amazing.
Yeah.
Amazing. Crazy. I love this. And so there are a lot of discussions because of the biohacker community picking up momentum. I've seen, every time I go to a biohacker conference in the last 2 or 3 years, I'll see people dispensing, like selling these little hydrogen bottles, making bottles and different things. Talk to me, like, how does the consumer differentiate about what's a good, like, what kind of questions do they need to be asking or thinking about when they're looking at purchasing, a hydrogen system for their own use? Like, what are things to watch out for? What are things to look for? And go from there.
Right. Yeah. When my focus turned towards hydrogen, one of the cheapest ways to get into it was buying one of these, countertop little bottles that, hydrogen bubbles into the water to treat it. So I said, well, I'll try that first before I spend more money or build my own system. And I really didn't notice an effect for that. And I think in most part because it was just not enough to get an effective dose, right? There's a limit to the effective dose. And I wasn't getting it from the hydrogen bottle. And I got one of the nice ones out there. It was almost $300 for a little bitty bottle. And so I almost put it to the side on the shelf. And then I revisited it, like, I don't know, maybe 6 months later, I just put it aside. Well, this is not working. So I said, okay, well, I finally had some time. So I built my own machine that's producing as much as 1 liter of hydrogen per minute. Oh, wow. And so there's also to contrast that, there are little hydrogen tablets, magnesium.
I was just going to ask if you would contrast the tablets as well, which are picking up momentum of popularity. I like to travel with those, by the way, like when I don't.
Right. Yeah. Well, which is a good idea. I mean, that's great if when you're out of your normal element, when you don't have a machine to get the real, therapeutic dose. But the way I like to explain it is like, okay, well, in a small, like, half-liter bottle of water, where you dissolve some hydrogen bubbles into it, or a small tablet that you put in some water and dissolve some nanobubbles into there, you can't fit 1 liter of gas into 1 liter of water. It's just not physically possible. So how much are you really getting? And so contrast that to the therapeutic machines, which produce as much as 1 liter of hydrogen per minute.
Wow, that's crazy.
And then a normal session would be 15 to 20 minutes, half hour, even an hour easily. And so you're getting as much as, 30 to 60 liters of hydrogen. And that's really permeating your body and diffusing through your body really quickly. So there's a big difference. And so maybe you're paying, I don't know, $30 a day for a month's supply of these pills, but a machine can deliver that in just 30 minutes. Amazing. Well, no, less, because it's like just a big difference in volume right there, which you can put into water and then what you can breathe.
And so like a typical, let's say you have a patient who's going in to get, they're going through their 10 weeks of, or 5 weeks of radiation therapy. What might be a protocol like, and I know you're very careful, this is like an N of one, please talk to your medical team to get advice here. But if they are looking at like, what is this? Do they sit with this cannula for 15 minutes morning and night? Like what's a typical dosage? How is it typically ingested? You showed us the cannula, you mentioned the water.
Mm-hmm.
Give us an example of how you dose this, how you apply this in a day-to-day experience.
It really depends on the person and their lifestyle. The more you do it and the better you can fit into your lifestyle, and the easier it is to fit into your lifestyle, the more you're going to use it and the more you're going to benefit from it, right? And so for the first like almost 2 or 3 years, I was breathing it overnight because that was the only time I was still.
Okay.
So I was putting the cannula on me and sleeping with it overnight, going 8-9 hours sometimes, right? Which is perfectly fine. But then over time, I started doing it every other day, just experimenting. And then recently I've been doing it like an hour before I go to bed and an hour when I wake up in the morning, just before I go to bed and before when I wake up, right before I'm getting out of bed. And if depending on what conditions you have, there may be times where you need more of it, and in like different delivery mechanisms. Like we had a client with diabetes, his leg was swollen up, about to be amputated, couldn't walk. So, we'd bag his leg and get him some water, because breathing hydrogen doesn't get to your extremities as, easily. And so depending on the condition, you may want to use it more so than a person that's using it for just maintenance, or an athlete that's just wanting faster recovery.
Wow. 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 And so how do we learn more? There's I feel like this is the iceberg. We've just shown the teeniest tip of the iceberg for everybody today. So how can people learn more? Where can they find a device like yours, and how do they get going?
Yes, once we started getting a lot of people contacting us, we said, well, we got to put up a website, either give people more information or start getting this out to the public. And so our domain now, our website is H2Biohacker.com.
Okay.
Because I've been a biohacker, in that community for years and years, and so that's kind of how we refer to ourselves. And because it's hydrogen, it's like H2Biohacker.com is what it's become.
Okay. Awesome.
And so one thing to point out on our website there, depending on someone's situation, conditions, we've got 2 machines that we offer on our website. What we recommend is to people to sign up for a free consultation. There's a link on the website. And so that way we can tailor, the protocols and recommend different systems, or whether it be, pure hydrogen or Brown's gas or combination of the gases, and also work with them on how often to do it and how to do it depending on their conditions.
I love it. So it really is N of one. You really can help people understand when, where, how to apply this, or help their clinicians know how to apply this. Right,
well. Exactly. We do have a practitioner program, and actually we've been focusing and specializing in that direction because it enables us to reach more people more quickly. So we're actually teaching practitioners, and we're working on a special program for them. So to teach them, make it easier for them to share with their patients, so that everyone benefits in that process.
Well, you and I are going to talk about that one offline, because we've got ideas for you on that one. So that's great. I love it. I love it. I can already hear my network going, yay. So good. So good. And so I understand that you have a special for the listeners of Dr. Talks Summit, Cancer Summit 2.0, Cancer Breakthrough 2.0. Is there something you want to say here so that folks know that not only can they get a free consultation, but maybe there's a discount code or some other code that you're offering for our listeners?
Right. I can't say how much at this point, but it's going to be a significant amount, right? But if you use the keyword or discount code Dr. Talks when you go to checkout, a discount will be a nice discount will be applied to your order.
That's
for those that are ready to just jump right in and try it out right now. But again, like there's a free consultation available, and that'll put you in touch or schedule an appointment, and either I or Shri will be talking to you, and we can go into more details on how the hydrogen can benefit you.
I'm excited. Well, I will be talking with you and Sri myself soon, because I've been wanting to bring this into my home on a bigger level. I have those bottles and I use those, and I use the tablets when I'm traveling, and I do just feel called to doing a little bit more, especially with how much I am on the road, being exposed to all the things, feeling like I'm being bombarded, lots of reactive oxygen species flying around in my body. I need to do my own due diligence for good hacking and prevention. So I hope that the listeners got as excited about this conversation as I am. And Ben, thank you so very much.
Yeah, likewise. It's great speaking with you, talking to you again. We'll be in touch.